any questions for Dr. Azza? Yes?
Yes. I want to ask you, and so happy to see your papers, hear you talk, but can you say that there is the movement from the tradition to the institution making a lot of this problem? Because if you go back to the Arab culture and the Arab society, we had some problem, but we solved it by our view of sex and marriage and pleasure. But the change from the culture, the old good culture.
We will not change the culture or traditions. We can start educating them how to, and in a respectful way, how to have this education according to our traditions and religions. We will not change our traditions.
No, but that's what I mean. I mean, the problem you show is the result of the very fast change from tradition to institution.
Yes.
And therefore, we have to educate people, but we have also to understand what's happening in the society.
In our society, because it's here, in our society, different than here. It's not like Europeans or Americans. We didn't go for this freedom in sex to have these much problems now. Yes, you can comment.
It's an excellent, short and to the point presentation. But I just want to make a comment about the lack of experts in sexual medicine in the Middle East and about the lack of professional societies. I think this is true regarding the female side. There isn't much help for the females there. But for men, I don't think this is very accurate because we have the first doctorate degree offered in sexual medicine since more than 25 years. I had my doctorate degree in sexology now for 20 years. This is one point. Professional societies have been working in this area.
Just for male dysfunctions, there are a lot. But no one did something for female dysfunction.
And around a year ago, I think the Journal of Sexual Medicine, about 8% of the papers were from Egypt. So I just wanted to...
Yes, okay. For male dysfunctions, they all go to urologists. I said like that. They go to seek the advice of urologists about male dysfunctions. But even when a male goes to a doctor, he treats him alone. And his wife must be treated with gynecologist. And then there must respect psychologist to have also his role in treatment. So we need teamwork for everyone, not only male dysfunction and treatment only. That's I respect all urologists in Egypt. They are so clever. Okay.
We have 5 hands. Let's make it very short to the point, please.
Yes,
let's go.
Yeah.
Yes.
Yeah, thank you very much. I've had Dr. Kak speak and I listened to the FGM discussion this morning, and I'm very pleased to hear that a female doctor speaking. Could you tell us a little more about your position on FGM? Because you just said that your
position, yes.
changing, yes.
Yes.
Or FGC, whichever one.
We need. I was discussing with Dr. Today. We need our special researchers to see how frequent it is now, because it was done as a routine since before 2008. When a rule is put in Egypt, banned it, so doctors now cannot do it legally. But still, in urban area, in rural area like that, they can do without knowing for the government about these doctors. But still, in I don't know about Sudanese, Somalian, like that. They still do like that.
No, my question was, you had said that you would not be changing your traditions, and I was thinking, it's one thing to have to pass the law and another to enforce it.
No, traditions, that means if tradition is something harmful, we must change it. We must respect how to send them the message. Okay? I will not, some believe that it is a religious issue, it is Islamic issue. So I told the scholars can help us to say, no, it is not a religious issue, it is a traditional issue, like that. So if we can send the message in a good way, we can tell them that it must not be done. And then banning it is very good because sometimes it comes with rules.
Thank you. Are you satisfied with the stand? Let's have
I'm from Egypt. I'm a doctor. I'm a sex therapist. I'm also a counselor working in relationship therapy. I do agree with Dr. Ghanem. I do agree with Dr. Tarahony. We do treat male sexual dysfunction in Egypt, and I attended conferences before, which was like international conference about sexology in Egypt. However, we lack the work of couple therapy in Egypt. We have a lot of tradition, which we need to change. There is a difference between tradition and religion. Religion is there is certain things about religion we can change, but tradition we can work with it. So for circumcision, there is nothing in religion Islam to say it's allowed. That's why it's a tradition which we managed to pass a law to stop it. There is certain things I think in our tradition and culture they need to change, and I hope we can find the time and the work with all this group of people to change all this tradition and make people really have nice sexual life or good sexual life.
Thank you very much.
Okay.
Yes?
Thank you for your presentation. It's really good. My name is Anne Nathan from South Africa. Just two things. One relating to democracy, just in terms of what your wish is. Please correct me if I've misinterpreted it, that if one's wish is for democracy, then also the whole aspect about universal rights when it comes to individuals and what they like to uphold in countries is imperative. So there appears to be conflict between the practices of tradition and democracy. So correct me if I'm incorrect in that regard. That's the first thing. And then secondly, the approach that you have presented comes across as if it just focuses a lot on the medical side. What about the social aspects, the biological aspects, spiritual aspects, and have sexuality or sexology as an integrated approach versus just looking at it from one sphere, which is the medical side? So that's okay. That's the second question that I posed.
First question is democracy. What
Yes.
means democracy if I will limit some rules for sexuality? You mean like that, which is not a democracy? No, democracy means something that we can express our needs, but not against our religion and about Muslim countries, and we will not change our. If something related to Catholic, they said Catholic is this prohibits so and so, and about rules in Rome, there are some rules like that. So we must not respect even democracy in many things, but in certain issues we cannot put democracy as you can do what you want. We cannot do like that. Okay, you can express what you want if you want to live with. Homosexuality, he says homosexuality is in Lebanon. It is not allowed by rule. It is not allowed by persons maybe, but it is present. Some persons are and not seeking even advice of treatment to treat this issue. They don't consider it as a disease. Okay, but some consider it as a disease, so they must have somebody to treat them. Okay, if it is banned or it is it will go to the court, he must seek advice. We must find somebody to seek advice from. Okay, so democracy is something, but for this issue, we cannot put democracy as anyone can do what he wants wherever he will.
I think my point is.
Excuse me. I think this is a very extensive and interesting discussion. And very controversial, and probably will give her more time later on if you want to discuss democracy and sexuality. I think this is a conference that we can do in the Middle East. The second point, please.
The second point is what?
The second point is that it appears from the presentation that you focus in terms of.
Yeah, there are missing dimensions: the spiritual, the social, the psychosocial. You focus on the medical.
I'm a gynecologist and I see it from the medical point of view.
Oh, so
okay. But I am strict that there is psychology role, there is social role. I told we must train even social workers how to do this job. Even general practitioners must start to speak about sex and sex education. So we need a target group is wide for all to learn about and to teach them how to learn these issues. Okay,
We have
but
two more questions. We have two more questions. We have Fayruza, we have So only on the side I have saw another hand. Please go ahead.
Azza El Tarahony from Iran. I just actually, as I understood from this Middle East Committee for Sexual Health, I'm thinking of how this committee can help young people from this Middle East, because young people actually sexuality is shaping by the tradition, and at the same time they have access to new idea of other, sexuality, more liberal sexuality. So how this Middle East committee can help to frame or to actually to draft culture sensitive, sex education, not sex education, sexuality education, something.
Not Iran alone. Everywhere there is restrictions, and we cannot speak even if we tell sex. We are not allowed to tell this word.
Let me take this.
Maybe this committee can help
It's all the
to reach the consensus or to common understanding of a common approach for teaching sexual health to young people in Middle East, which is not very similar to Western countries, because we have a similar tradition or maybe religion constraint. So we can. I'm hoping that this
That
committee
we will
reach
start
to
work
this.
yes, we will start work for this issue. How to send our message in a proper way. Okay? So we can send it, because sometimes we are not allowed even to send it. Okay?
Yeah.
We will start.
Part of the mandate of this society is to assist in development of local societies and provide advice and assistance. These local societies, they are supposed to carry research, advocacy, and services and care related to sexual health. And definitely, sexual health of youth is a global evolving issue, and definitely this committee will embark on this